Welcome to our video on climate change and vector-borne diseases, the spread of malaria and dengue. As global temperatures rise, the effects of climate change are reshaping ecosystems and influencing the distribution of disease-carrying vectors like mosquitoes. Today, we will explore how expanding habitats and increased transmission rates are leading to a resurgence of diseases such as malaria and dengue fever. Join us as we delve into the urbanization, seasonal shifts, and other contributing factors that are causing a rise in these illnesses and discuss the economic and health burdens they impose on communities around the world, along with potential preventive measures. 1. Expanding habitats. Rising global temperatures are not just making the world a hotter place, they're also expanding the habitats of mosquitoes. These tiny creatures are the primary vectors for diseases such as malaria and dengue. Traditionally, mosquitoes thrived in warm and tropical climates, but as temperatures rise, they're moving to new areas previously too cold for them. Imagine a mosquito with a tiny suitcase, exploring new territories. This migration means regions once considered safe from these diseases are now seeing a rise in cases. For residents of these areas, it's like suddenly finding lions in your backyard when you live in a place that's never had them before. This change is particularly concerning for countries that lack the infrastructure to deal with these diseases. 2. Increased transmission rates. Warmer temperatures do more than just expand mosquito habitats. They also speed up the life cycle of both the mosquitoes and the viruses they carry. Think of it as putting a mosquito's life on fast forward. This acceleration leads to higher transmission rates of diseases like malaria and dengue. When mosquitoes develop faster, they can bite more people in a shorter time, spreading the disease more rapidly. It's akin to a factory speeding up production lines, resulting in more products, in this case, infections. Quickened virus replication also means that the diseases become more virulent, posing a greater risk to human health. 3. Urbanization and stagnant water. As cities grow, so do the problems associated with urbanization. One of the less obvious issues is the increase in stagnant water, which serves as a breeding ground for mosquitoes. Climate change exacerbates this issue by altering weather patterns, leading to more frequent and intense rainfall. Imagine a city being a giant sponge that collects water in every nook and cranny. In many developing regions, inadequate drainage systems mean this water lingers, creating ideal conditions for mosquitoes to thrive. As urban areas expand, the combination of human activity and climate change makes controlling mosquito populations even more challenging. 4. Seasonal shift. Climate change has led to changes in rainfall patterns and prolonged warm seasons in many parts of the world. These shifts have resulted in extended transmission seasons for malaria and dengue. Picture a summer that never ends, where mosquitoes can breed continuously without the interruption of cold weather. This extended period allows mosquitoes more time to reproduce and spread diseases, increasing the risk for populations in affected regions. The once predictable cycles of malaria and dengue outbreaks are now less reliable, complicating efforts to control and prevent these diseases. 5. Rising cases. The World Health Organization has reported a rise in global cases of malaria and dengue, with climate change identified as a key driver. It's as if the world is on a seesaw, with climate change pushing one side down, leading to a rise in disease cases on the other side. This increase poses significant challenges for healthcare systems, especially in developing countries where resources are already stretched thin. The rising cases highlight the urgent need for global action to address the root causes of these diseases. 6. Economic and health burden. The spread of malaria and dengue doesn't just affect health, it also has significant economic repercussions. The healthcare costs associated with treating these diseases are substantial, especially in countries with limited resources. It's like a financial black hole, sucking in money that could be used for other essential services. In addition to healthcare costs, these diseases result in lost productivity as people become too sick to work. This economic burden is particularly severe in developing regions, where every dollar counts. 7. Preventive measures. years. Despite the challenges, there are effective measures to combat the spread of malaria and dengue. Mitigating climate change is crucial, as it addresses the root cause of the expanding habitats and increased transmission rates. Improving sanitation and infrastructure, particularly in urban areas, can reduce the breeding grounds for mosquitoes. Additionally, mosquito control strategies, such as insecticide-treated nets and community awareness campaigns, are vital tools in the fight against these diseases. It's like assembling a toolkit to fix a complex machine, where each tool plays a crucial role in ensuring the machine operates smoothly. These preventive measures are essential in reducing the impact of malaria and dengue on global health.